Let's continue with the diagnosis according to 8 principles. The chronic exterior imbalances. Chronic exterior imbalances are typically B syndromes. B syndromes arise from the simultaneous presence of 3 separate types of exogenous chi in the channels and collaterals. There may also be disruptions of the channels themselves due to trauma or repetitive movements that strain the joints, such as computer arm and tennis elbow. This disorder, with the exception of physical traumas, will often have arisen gradually, but there may also be episodes of acute flare-ups. These flare-ups will often be due to climatic influences or physical strain. Etiology: invasion of exogenous dampness, heat, cold, and wind. Repeated stress on the joints. For the symptoms and signs, there is pain in the joints and or muscles. For the treatment principle, expel exogenous qi, regulate qi and blood in the channel. If there is qi deficiency, tonify qi. For the acupuncture points, choose from relevant channel points, local points, distal points, cross-channel points, and points to expel exogenous evil qi. If there is exogenous wind, add UB12, do 14, do 16, and LI4. If there is exogenous cold, add LI4 and do 14. If there is exogenous dampness, add spleen 6, spleen 9, and LI4. If exogenous heat, add do 14, LI4, or LI11. If there is blood stagnation, add spleen 10 and UB17. Needle technique, we do draining. For the exterior imbalances, are to be the factorial imbalances that are not exterior. Interior imbalances include all the imbalances where there is a change in the functioning of the sample organ and where the vital substances are affected. There may well be combined patterns in which there are imbalances in both the interior and exterior. An example of this would be a person who is kidney yang deficient, interior deficient cold, who is also invaded by a wind heat, exterior excess heat. Imbalances in the interior can arise in one of the 3 ways. The first, exogenous evil chi that has been located in the exterior penetrates downward into the interior. Second, exogenous evil chi can directly invade certain food organs. And interior imbalances can also arise due to other factors such as diet, emotion, and over-insertion, affecting the sample organs and or the vital substances. Invasion of exogenous evil chi will usually be acute, whereas most other interior imbalances will be chronic in nature. When an imbalance is in the interior, it will have affected one or more of the sample organ or the vital substances themselves. This means that the body's physiology will be affected, and this will be apparent in the signs and symptoms that are manifesting. When there is an interior imbalance, certain organs and vital substances will not be carrying out their function optimally. There will be observable changes in the functions such as urination, defecation, appetite, sleep, and so on. Because the imbalance will have lasted for longer than exterior imbalance, and because the body's physiology is affected, there will not only be changes in the pulse, but the tongue will also show signs of change. So we have here a table, the differences between the interior and exterior imbalances. In the interior, we have mainly chronic, while in the exterior, it is mainly acute. For the interior, may be due to 6 forms of climatic evil chi, the 7 emotions, and the diverse causes, while the exterior usually caused by one or more of the 6 forms of climatic evil chi. For the interior, the sangpo organs, blood, qi, jing, or jing will be disturbed, while the exterior, the channels, weighty skin, tendons, or muscles will be affected. For the interior, there is disruption of the body's internal physiology, while the exterior, the body's internal physiology is not disrupted. For the interior, there could be changes in the pulse and tongue, while in the exterior, generally, only changes in the pulse. For the interior, the pulse is generally not superficial, while the exterior, we can feel the superficial pulse. For the interior, usually there is no aversion to cold and wind, while in exterior, usually there is an aversion to wind and cold. For the etiology, if exogenous evil chi is not expelled from the exterior, it can penetrate into the interior. This will occur because the evil chi is very virulent, sen chi is weakened, or the person has been treated improperly, and evil chi has been dragged inward and downwards. Initially, evil chi penetrate into the interior will be an excess or a heat condition. The symptoms and signs will be powerful due to struggle between sen chi and evil chi. This corresponds to the Yang-Ming stage of the 6 stages or the chi level of the 4 levels. If the evil chi is not eradicated, if there are repeated invasion of exogenous evil chi, or if the body's sen chi is deficient, the evil chi can penetrate even deeper into the body and will develop into a deficient pattern. This will be similar to the Tai Yin, Xiao Yin, and Zhou Yin stages and the Yin and blood levels. The patterns here can be hot or cold patterns. Exogenous evil chi can also directly invade into the interior. These invasions are almost exclusively into one of the 2 organs. This will typically be when cold or dampness invades the intestine, stomach, urinary bladder, or the uterus, or when damp heat invades the intestine or the urinary bladder. Direct invasion of the exogenous evil chi into the interior will manifest with acute symptoms, which will be excess conditions. The internal organs and vital substances can be affected by the 7 emotions and the so-called diverse or miscellaneous causes, such as diet, overwork, lifestyle, and so on. These imbalances will be chronic, but there may still be acute symptoms. This is typically seen when there are combined deficient or excess patterns. An example of this could be liver yin deficiency with ascending liver yang. Here, the person will often suffer from acute migraine attacks, even though the underlying patterns are chronic. Symptoms and signs. There can often be a complex mixture of symptoms and signs resulting from several organ functions being affected, and there can also be a combination of deficient and excess patterns. Knowing that the imbalance is in the interior is not precise enough. It is necessary, however, whenever possible, to locate the imbalance in the interior and find out what its nature is. There will be significant differences in the symptoms and signs between the various interior imbalances, depending on which organ and substances are affected and whether the combination is deficient or excess and hot or cold. Thank you for your attention.